Good evening, everyone, and thank you for joining us tonight. Before we get started, I would like to read the brief disclaimer that you see on your screen. And the disclaimer is this: the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to welcome you once again to the program. My name is Craig Orpello, and I will be your host tonight. The PharmAssist Virtual Learning Experience is an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday night at 7 p.m. Eastern. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And how is it interactive, you may be asking? Well, that's where you come in. You are joining us either via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, either directly into the chat or in the Q&A on Zoom. So we are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. Tonight, we are joined by Karen Hammond. So thank you again for your time and interest this evening, and I now want to turn it over to Karen. Take it away. Thank you so much.
Awesome. Thank you so much, Craig. And thanks to all of you for joining us tonight. I know it's the finals for basketball tonight for college basketball, but I think we've got a couple hours to go before that. So maybe you're watching this alone, or maybe with somebody else, or maybe even you're taking a look at it on demand. All of these videos are going to be available from myself as well as from other providers on the Mandel's website, mymandels.com. And you can also find these on Facebook. So I am Karen Hammond. I am a doctorally prepared women's health nurse practitioner, and I've been taking care of patients that are struggling with fertility issues for 36 years and change now. It'll be 37 years in a couple of weeks, so maybe a week. And so I am very accustomed to all kinds of questions. It's interesting how medications have changed over time. They've actually become much easier than they once were. Back when I first started in this field, there was one drug to stimulate your ovaries that was injectable. It was called Pergonal. It's no longer on the market even now. Came in a little glass ampule. One had powder and the other had liquid. And it came with a tiny little file early in the day. We'd have to take that little tiny file and score the ampule, just like a little saw. And score it all the way around, or sometimes I'd get lazy and just do it on a part of it, snap it open. Actually went to had to go to the ER once where I practiced at the university here. And because I got a little glass fragment in my eye, so it helps to wear glasses, I guess. Anyway, tonight I'm going to talk to you about 3 medications. I want to make this nice and easy for you. No saws involved, no little files involved to have to prepare your medications. The medicines I'm going to talk to you about tonight are going to be the Gonal-f 75 units. I'm also going to talk to you about taking HCG, which is a very easy drug to do. I'm going to just go through it with you step by step, just to make this all very simple for you. And the other medication I'm going to talk to you about is Menopur. These medicines, all 3, need to be reconstituted or mixed. So you'll have a liquid and a powder. The way this is going to work is I'm just going to tell you about the drug, what it is. Then we'll queue up a video and have you take a look at that on exactly how to mix it. And then on the other side of the video, I can answer any questions you have. So think about questions as you go. If you're on Facebook, you can type them in. Same thing on Zoom. Just take a note of the questions. If you're watching this on demand, you won't have that luxury of having the questions answered immediately, but you can always contact your provider. Talk with your doctor, your nurse, talk with the folks at Mandel's, and we'll make sure that your questions all get answered. So we'll start out with the first medication, and that is the Gonal-F that comes in 75 units. This medicine is generally administered subcutaneously, which just means in fat, just under the skin and into the fat. So it'll be a tiny little short needle. So Craig, if you'll go ahead and cue up that video, we'll take a look and then we'll answer some questions. Hi, I'd like to talk with you a little bit about how to give the Gonal-F vial. It will come in a package that has a vial, 2 needles, and a syringe that has the saline to dissolve the powder that's in the vial. You start by just simply opening the package and removing the contents. Next, there's a little cap that covers the tip of the syringe. Just unscrew that to remove. Then you can put the needle directly onto the syringe. Your provider will tell you whether to use an intramuscular or subcutaneous needle. In general, this is given subcutaneously. Next, you'll take the top off of the needle and grab the vial that has the powder, the medication in there. Gently lift off the top of that vial. Put the needle directly into the rubber stopper on the vial and inject all of that liquid into the vial. Each vial has 75 units of Gonal-F in it. If you're prescribed more than that, you may need to use more than one vial. You'll still just need to use one syringe with the liquid. Next, turn the vial upside down and withdraw all the liquid by pulling back on the plunger. After you removed all the liquid, remove the needle from the rubber stopper of the vial, and you're ready to give the injection. Start by just wiping off the area that you've selected to do the injection one time. Put the needle straight in after you've bunched up the skin, slowly push in the medicine. Release the skin and pull the needle straight out. If there's a little drop of fluid or some blood on the outside, just simply wipe it with some alcohol and apply a bandage if necessary. Finally, take the syringe with the needle on it and drop it into a sharps container just to prevent any injury from it later on. And now you've given your first Gonal-F vial. Wow, that is pretty easy, isn't it? So let's just kind of go back a little bit. The Gonal-F is a hormone, FSH, follicle stimulating hormone. And that's interestingly one of the few things in our body that's named a few hormones that does exactly what it says it's going to do. And it's going to stimulate your follicles to grow. Your follicles are the sacs that hold the egg. Each follicle has one egg in it, and that FSH is going to stimulate that follicle, or maybe those follicles, to get bigger and more mature. As I said in the video, this can be given intramuscular or subcutaneously. The vast majority of people recommend that you take it just in the fat, subcutaneously. And you want to choose a place. Most people will do it either in their abdomen, beneath the belly button and out the side a little bit where this blue shading is indicated, or in the outside part of the thigh, always the outside. And you want to just pinch an inch and put the needle straight in all the way. Some people prefer to give it in their arm. If you do that, you may want to rest the back of your arm on a firm surface so you can just reach around and put the needle straight in all the way. I found that patients have an easier time if they do it just in the outside part of their leg, but most commonly in their belly. There aren't as many nerve endings in our bellies, and that skin's generally not as exposed to the elements like the sunshine as much as maybe our arms and legs are. So the skin's going to be really soft, and that needle will penetrate the skin very easily. This injection is, gosh, it's painless. I can't imagine you're going to feel this at all. I never have patients complain of irritation or redness or even discomfort with each of these injections. So it's given as 75 units. If you have been asked to take by your provider to take a higher dose of this medicine, you'll still just use that 1 cc of liquid that's already drawn up in the syringe. But if you do that, you'll just squirt it into one powder. If you need to take 150 units, you'll take that entire amount and squirt it into the next powder, draw that up, and that way both of the 75 units will be loaded into the syringe for a total of 150 units, and you give it the same way, and you're not going to feel any extra discomfort if there's an extra 75 units added into there. Again, it's a really simple to mix. The liquid's already drawn up. It's ready to roll. As soon as you put the liquid into the powder, draw up the mixture, and then give it in one of the sites, like I mentioned on the little graphic, either in the outer part of your leg, your abdomen, or maybe give it in the back of your arm. So Craig, I'll turn it over to you and see what questions we have from folks.
All right. How's it going, Karen? Perfect.
Hi.
All right. So we got a bunch of questions coming in. So the first one comes in asking, how long can I expect to be on Gonal-f on average?
That's a great question. This medicine, as well as the Menopur that we'll talk about in a few minutes, both are stimulating your eggs to grow. And everybody's a little bit different. That's why your provider is going to recommend that you come in for periodic monitoring with ultrasounds and maybe with blood tests, just to see how your follicles and ultimately your eggs are growing and responding to the medicine. Some people respond very quickly and may only need to take this medicine for just a few days. Other people may take it for many days. There are some folks who do what we like to refer to as a low and slow protocol, where you take just a very low amount of medicine and we very slowly give you a low dose of this every day. And it may be even over a course of a couple of weeks or even longer. Most people average taking this probably 7 to 10 days.
Perfect. Thank you very much. That's a great answer. And I know sometimes, just as everyone, you're out there thinking about different questions, you can, any questions are available. I mean, you can ask questions very specific to, like we just got, about how long am I going to be on, or specific to what types of side effects might you get. But also plenty of times people want to ask kind of bigger picture questions, or how is this going to, interact with the rest of my cycle, things like that. So feel free to share any questions that you have, either again into the chat or directly into the Q&A if you're joining us via Zoom, like this person did. This question comes in that says, how does Gonal-f work as part of my treatment cycle? So there you go.
Yeah, excellent. So that's what I covered just now a little bit, but technology is awesome, but sometimes it's a little delayed beyond when you type in the question and we start to answer it. But it works just by stimulating your eggs to grow. So it's follicle stimulating hormone. It's kind of interesting how our brains work. Normally, we just want to stimulate one egg to grow. So there's a delicate balance and a little dance that our brain and ovaries are communicating, so that you don't really see a lot of people walking around with high order multiple pregnancies. You don't see many triplets, or certainly not quadruplets or more, walking around these days, because we're really careful to control this medicine and control the dosage and kind of anticipate how you're going to respond, how many eggs you're going to get. Of course, it's different if you're doing ovulation induction for just to stimulate your ovaries to do an insemination, or maybe to do just timed intercourse. Then it's different from doing that than if you're doing IVF. So we're taking the eggs out and we can control how many embryos go back in. All of these are reasons that we monitor you while you're taking these medications. We want you to have follicles that are just the right size and right and ready for whatever treatment that you're undergoing at the time. What other questions do we have, Craig?
We do. We have another one specific to the 75 IU vial itself. The question comes in that says, what's the most common usage for the individual 75 IU vials as opposed to a multi-dose or a pen or something like that?
That's a great question. So most commonly, I think patients are prescribed to take either a pen or a multi-dose if they're prescribed to take Gonalef, and that will have between 300 to 900 units in what you purchase at one time. Other times, patients may be needing to take just a little bit more, and if we want it to be cost effective, so if you just need just another 75 units or maybe 150 units, this will avoid your having to go ahead and pay for 300 units or a higher dosage. So sometimes we can stretch it out just a little bit longer just by getting a tiny amount that would be just what you need, be more cost effective for you, and that way you wouldn't have a lot of leftover medications. Your providers and the folks at Mandel's want to make this as convenient for you as possible, but we also think about the cost. We don't want you to spend any more money than you have to. And many insurance companies, as we are all well aware, don't always cover the cost of these medicines. So we want to do our best to keep that at a minimum. Great question.
And yeah, I might as well just add in when we're talking about the different ways to help out when it comes to the financial aspects of it. That's one of the great things that Mandel's will offer is that financial counseling to help work with your clinic to make sure that you're getting exactly what you need at the most affordable option available to you so that you don't have to do the heavy lifting to figure that part out. We just want you to focus on going through the process and getting to that end game that you want with the pregnancy, and let us work with the clinic to make sure that we can find the right financial options for you and the right presentations that make the most sense. So perfect. Thank you so much. You teed it up and I figured I might as well knock it out right there. So
perfect.
Sounds good. As of right now, it looks like we are all caught up on questions. I was just really quickly jumping back over to check on Facebook. Looks like we are all good right now. So as always, what I'd like to do, we'll give another like 30 seconds or so in case somebody's trying to type that last question or the last answer you heard just sparked an idea that you wanted to ask. Keep in mind that we do not, once we move on to the next product, you can ask your question again there too, even if it's about the Gonal-F. It's not that this is your last shot. You can actually bring up any questions at all, whether they're specific to the products or a little bit more general about your treatment cycle, anything like that. That's what Karen is here for tonight. So Karen, how about we give another 30 seconds or so? I'll kick it over to you in case there's anything else you wanted to share before we move on to product number 2.
Perfect. So I would like to tell you, again, related to the cost of these medications, they're not inexpensive. Not only will Mandel's help work with you to find out what format of medicine might be best for you, as opposed when we're looking at the 75 units or the multi-dose pen or the multi-dose vial. There is also a program that Serrano, the manufacturer of these medications, has called Compassionate Care. They'll also help you walk through the steps from that. Your provider is likely to talk to you about compassionate care, and that's for use when people don't have insurance coverage for medicines or maybe don't have insurance at all. There's an online little thing that you go through and fill out. It is income-based. But I think you get something just for applying for it. I tell all of my patients to go ahead and apply for it. It's just like saying if you can get a coupon, if you can get 50 cents off of something, I recommend that you go for it. With this, you get a percentage off the cost. And I've had lots of patients who get 50 or even 75% off the cost of the medications. So it's definitely worthwhile to apply for that. And the compassionate care covers all the products that are made by EMD Serrano, which would be Gonal-F, it would be the Cetratide if you've been prescribed that, or even the recombinant HCG called Avidrel. Any other questions coming in, Craig?
It looks like we are all caught up right now, so we're ready to go
Perfect.
And move on to product number 2. And of course, like I said, if you think of any other questions out there about Gonal-F, Feel free to bring them up at any point in time. We will certainly make sure that your questions are answered. So we're ready to move on.
All right, great. So the next product that I'm going to talk to you about is HCG. There are a couple of, or a few different brands of it, but they're all essentially done the same way. HCG is human chorionic gonadotropin, and what it actually does is it mimics the LH surge. It helps do the final maturing of the eggs, and ultimately the eggs will release unless you have IVF and they're retrieved before that time is up. Generally, it's probably about 40 hours. This medication is told oftentimes to be given at a very specific time, where most people will say take the Gonal-F in the morning or in the evening, or maybe for some patients in the morning and the evening. With the HCG, you will likely be told to take this at an exact time. For example, 9:30 p.m. And we want you to take it as close to that exact time as you can. Again, this medicine needs to be reconstituted or mixed, where you put liquid into the powder and then draw up the mixture. It can be given intramuscularly or subcutaneously. The package insert, if you read that, it'll say to take it in the muscle, but for, gosh, probably at least 2, maybe 3 decades, we've been recommending that people can take it in the fatty tissue as well. Makes it a bit easier. We'll talk about that a little bit in the video and on the other side of it. So Craig, if you want to go ahead and cue up the video, we'll learn how to reconstitute and administer the HCG, and then we'll answer some questions. You have been prescribed to take HCG by your healthcare provider. You should have been told a specific time to take this medicine, because this does the final maturation of your eggs to prepare them for either ovulation or egg retrieval. It's actually quite simple to do this. There are a couple of routes of administration you can do this. Your healthcare provider will tell you whether or not to take this injection directly in the muscle or just into subcutaneous fat. So we'll go through both those ways. If you've been prescribed to take this medicine just subcutaneously, then that should be given in the area beneath your belly button and out to the side, or in your outer thigh. To do that, you just bunch up a little bit of tissue and put the needle straight in. If you've been prescribed to take this medication intramuscularly, it should go in the muscle of your hip. To do this, just put your hand on your hip bone, and way up in the upper outer quadrant is where you'll give this injection. And you can see in this picture, it's the upper outer quadrant. Your nurse or healthcare provider will be happy to point out exactly where you should give this medication and whether you should take it intramuscularly or subcutaneously. To mix the medication, it's actually quite simple. You'll need the contents of the box of the HCG, which will have a vial that has liquid and a vial that has a little bit of powder in there. It may actually look like a little cake. Next, you'll need a syringe to mix the medication and to draw it up for injection. Start by removing the cap from each bottle, just by lifting it up. The powder and the liquid, just lifting it up to remove it. Next, open this package that has the syringe and the attached needle, and then remove the top from the needle, just by pulling it straight off. Next, take the tip of the needle and insert it into the middle of the rubber part of the vial. You'll want to be able to see the needle in the liquid. Although there are 10 cc's of liquid in the bottle, you're really only going to need about 1 cc. The exact amount of liquid doesn't really matter. The liquid is simply to dissolve the powder. I generally tell patients to withdraw 1 cc. And you do that by just gently pulling back, making sure that the needle can be seen in the liquid. If you have a little air in there, that's okay. Then take it out. Just push straight up to make any air bubbles come out. And then take the bottle of powder and insert the needle into the same place at the top of the vial. push in all of the liquid, and the powder should dissolve pretty instantly. If necessary, you can just swirl it around a little bit and it dissolves very quickly. Then turn the vial upside down, again making sure you can see the tip of the needle in the fluid, and withdraw all of that mixture. And remove the needle from the vial. If you've been told to take this medication intramuscularly, it's ready to give. The needle's already on. You just simply need to choose your injection site. If it's going to go in the muscle, it'll be this needle. You separate the tissue so that it'll go deep into the muscle. One wipe with alcohol, and then put the needle straight in all the way. Pull back on the plunger just a little bit. You're probably going to get a little bit of air back. That's completely normal. If you get blood, just pull back just a tiny bit on the needle and go ahead and push the medication in. And then pull the needle out straight, all the way out. If you have a little drop of fluid or a little drop of blood, that's completely normal. Just wipe it with an alcohol pad, and you can apply a bandage if necessary. Then you can carefully recap the needle, remove it, and place it into a sharps container just to avoid any injury later on. If the medication has been prescribed for you to take subcutaneously, choose the injection site and change and put on one of the smaller needles that will be prescribed that will be sent to you with your medications. The needle will just similarly screw right on the tip of the syringe. Choose your injection site, wipe it just once with a little bit of alcohol, bunch up the tissue, and take the needle, put it straight in all the way, inject the medicine, release the plunger, pull it straight back all the way. Recap the needle and place the needle and syringe directly into your sharps container. Congratulations, you've now reconstituted and administered your HCG injection. Perfect. Perfect. So that's pretty easy as well. It seemed a little bit longer for that video just because you can give it in the muscle, or you can give it in the fat. Your prescriber may have a particular preference which way to do it, whether he or she wants you to do it in the muscle or subcutaneously. So make sure you understand from your provider how to do it. Craig, what questions do you have for me?
All right. So we have some questions coming in. First one is just, I guess, basically looking for a little bit more information just about HCG specifically and how it works. I know you touched on it, but it says, can you explain a little bit more about how HCG works in a normal, healthy cycle? And what's the difference between a generic HCG and something like Avidril?
Oh, great questions. So the HCG is, again, it's human chorionic gonadotropin, and it does the final maturation of your egg. So it's the last step that the egg needs to go through before it's released with ovulation. Some women, for whatever reason, just don't ovulate without a little bit of help. Sometimes they grow nice big follicles, but they're never released, and this will take care of it. Other women that are taking medicines such as clomiphene citrate or letrozole, perhaps, they will just need that extra little push or need some appropriate timing for when to have intercourse or when to have the insemination done. Some people ask me, why in the world would I need to take HCG if I'm doing IVF? I don't want to ovulate. I don't want my eggs to be released before I have the egg retrieval. And that's part of the reason we tell you to take it at a very specific time. We want the eggs to be fully mature, and this does do that final step of fully maturing the egg before ovulation occurs. So we're going to have you take that at a very specific time. Usually it's between 34 and 36 hours before a procedure is scheduled. So your healthcare provider will help direct you with that. So how is this medication different? There are several different formulations of it. It may look a little bit different. So if you've taken one in one cycle and then you come back and take a different brand in another cycle, it may look like the little vial that has powder in it has more powder or less powder, or it may look like it's not powder at all. It's just like a little cake at the very bottom of it. All that's fine. It's just the brand and what it is, but it's going to have the right amount of medication in there. There is another formulation of this medication that's made in the lab. The HCG is human chorionic gonadotropin. It's derived from natural human products, where the Avidrel is a recombinant or a lab-made HCG. For the recombinant HCG or the Avidrel, we've got videos that we're happy to share with you on that. You can find them on the website or on Mandel's Facebook page or my Facebook page for that matter to see exactly how to do those. But that comes where it's already pre-mixed and ready to give. It does need to stay refrigerated. Regular HCG does not have to be refrigerated, where the Avidrel does. So I hope that answers your questions about that one. What other ones are there, Craig?
Perfect. So actually, this question came in as you were answering that. So I think, it probably prompted this question. And the question asks, when you mentioned about a specific amount of time that somebody needs to take the shot prior to their, ovulation and all of that, how tight is that window? How much time can I, if I'm over by a few minutes, how much time can I have an issue before I need to call and say, I missed it, what do I do now?
Perfect. And that's a really, really important question. If it's 5 or 10 or 15 minutes on either side, it's going to be no big deal. But if it gets to be an hour or 2 hours, or certainly any more than that, that warrants a call to your provider, even if you're supposed to take it in the middle of the night. On my own experience, I've had patients sleep through their alarm if they're going to take it in the middle of the night. As healthcare providers, we kind of like to do things as much in business hours as we can. So if you count back 35 hours, which is the length of time that I personally use, if you count that back and you're going to have a procedure done in the middle of the day, you're probably going to be taking that shot in the middle of the night. I tell people to use every device in their house to wake them up, to make sure they wake up and take it right on time. They tell Alexa and Siri and the alarm clock and your husband and your friend that works night shift, tell everybody to help you up, help you to remember to get up and get the injection. But mistakes happen. Sometimes it may be that the time of your procedure needs to change. Other times, if it's really off, it may mean that your cycle is canceled. And we never want that to happen. So try to be as careful as you possibly can about taking that injection right on time.
That's great. That was awesome. Great answer. Thank you so much. And I know this is actually a good time to kind of piggyback on what you mentioned, Karen, that a lot of times we get the question that people are wondering, how can I involve my partner or significant other, and what can they do to help out, whether it's to give shots or, help throughout the process. This is a great time for that helping, is to work together with a partner, a significant other, a close friend, family member, to have your back and help with that time. So especially if it is in the middle of the night, to make sure that, you don't miss out on that. So there's a little bonus question and answer right there. So involve your friends and family whenever you possibly can. So great. Okay, let's see. Another question coming in saying, what possible side effects should I be on the look for when using HCG?
Great question. And I always wonder about side effects about medications in general. And I find that my patients ask a lot of questions about that. Hopefully your providers told you a little bit about what to expect. The side effects actually of HCG, if you're just taking HCG and no other medications, are really very small. If your ovaries have been stimulated and you take the HCG, that's when it's after that HCG that you may have some risk of ovarian hyperstimulation syndrome. And that's where when your ovaries are really stimulated, they get bigger. You can have a fluid shift where the fluid goes from inside your cells to outside your cells. So you get bloated and puffy and maybe gain a little bit of weight. All of those things are normal if we're pushing your ovaries to grow lots of eggs. But if you have nausea, vomiting, if you have pain that's worse than menstrual cramps, or if you gain more than about 5 pounds, that's the time to call your provider, let them know what's going on, and see what kind of things they recommend for you. It's not a really common thing. Most people feel themselves ovulate, or after an egg retrieval, they feel a little bit puffy or sore. Those are completely normal. Most people don't end up having hyperstimulation. But if you do have it, we want to be on top of it. Probably a much more common thing that we see, if you've been told by your provider it's okay to take this in your belly or somewhere subcutaneously in the fat, you may notice a little bit of redness or irritation. Sometimes it looks like you've been stung by a bee where it was. It may itch or feel red or warm. May sting a little bit going in. Most people don't complain of that. But if it looks like you're having a little reaction to it and it gets swollen or angry looking right where you gave the injection, that's actually pretty common. I tell patients, and I honestly see it in patients about a third of the time. If you've taken it once and didn't have a problem, you take it again and you have that little redness or that local reaction, we call it, right where the injection was given. It's not going to interfere with the efficiency or effectiveness of the medicine at all. It's just a little bit of a reaction. The proteins in this are a little bit bigger than they are with the recombinant medicine, but the dose of this is a little bit higher than with the recombinant medication too. So it's a little bit of a trade-off. I don't see it very commonly if you take it intramuscularly, but if you take it subcutaneously, it might look like you've had a bee sting, red, maybe tender or itchy for a day or two, and then it'll go away as fast as it came on. So that's really the only side effects that you may expect.
Sounds good. I think probably nowadays, most people are a little bit more familiar with injection site reactions, with everything with everyone getting COVID vaccines and everyone being impacted differently, and you get a chance to really see what some of that tenderness and the local injection site reaction is. So just perfect timing. Probably people a little bit more. It's on the top of people's minds right now. Actually, speaking of, just in case, because this question also came in and you touched on it there, so we may have actually just kind of answered everything, but in case there was anything else you wanted to add, somebody actually specifically asked about OHSS and wanted to know, what should I do if it happens to me? So I don't know if there's anything you wanted to add to that. You touched on quite a bit of it in that last question.
Well, it's still is important to make sure that that person, as well as other people that may be watching tonight, understand that ovarian hyperstimulation can be a serious thing. So one thing we want to do is to minimize the likelihood of it happening, and we can do that to a great extent by monitoring you and adjusting your dosages of medicine appropriately. But another thing that you can do is make sure that you have plenty of oral intake of liquids. I tell people to drink things like Gatorade that have electrolytes in there, maybe even tomato juice or V8 juice if you like that. Pedialyte is another option, kind of those electrolyte enhanced drinks that you can get at any grocery store or drugstore. Those things are helpful. Some people say you should increase your protein intake, so it's a good time to delve into a big hunk of red meat if you like that. But anytime that you think if something doesn't feel quite right, it warrants a call to your provider. We never mind being called. It's much easier if you've got hyperstimulation for us to know about it and start addressing those things early than it is to wait till you're really sick and we have to play catch up and you'll be uncomfortable. So if you have nausea and vomiting, pain worse than menstrual cramps, or you notice more than about a 5-pound weight gain, those are all times that you should call your provider, as well as any time you have anything going on that's concerning to you, any symptoms that you may have that are out of the ordinary for you. Always err on the side of caution and contact your provider just to run things by them and get some reassurance and maybe some good advice as well.
Great. Thank you so much for all that. I think that's very helpful, because one of the things people, we know we get a lot of questions here on the questions around When should I reach out to my provider? When should it, when is it just something that, oh, this just happens normally? And that's a great part about the PharmAssist program, is it allows you to ask those questions now so that you can understand when you should be reaching out, because it's not the first time that a patient's going to be reaching out to their clinic. So if you're worried about that, do not worry about it. That's part of the process, is to make sure that you're keeping your nurse and your physician in a loop on any of these types of potential side effects. And sometimes you might find out, oh, that's no problem. And other times, good thing you reached out, because now we can adjust or do something there. So great point.
Exactly.
Thank you so much, Karen. It does look like we are all caught up on questions with HCG. So as of right now, I'll do, just like we mentioned before, we'll give another 30 seconds in case somebody has a question. And if not, we'll get ready to move on to the third and final product of the night.
Perfect. So I just kind of want to underscore what Craig and I have both said. Anytime you have questions, anytime you have concerns, that's the time to reach out to your provider, your doctor, your nurse, somebody in the office, just to let them know what's going on. I always encourage my patients to contact me. In fact, I give them my cell phone number. If something's bothering you, then it's bothering me, and I want you to reach out to me. It may be something very simple, and it'll put your mind at ease, so the question doesn't keep you up all night worrying about it. Then again, if it's something that you do need to worry about, we want to get you taken care of there too. So I can promise you, your providers will never be disappointed if you reach out to them with any question. It's a struggle enough as it is for you to go through all the things that you're having to go through with your fertility concerns and with your treatment. The last thing we want you to do is to worry unnecessarily. So always feel free to reach out to us. Any final questions, Craig?
Yes, actually, this one just popped up while you were answering that, when you were talking right there. It says, I'm supposed to get my second COVID vaccine around the time of my HCG shot/retrieval. Any thoughts or information that I should be aware of?
Great question. And this is a hot topic right now. The FDA, the World Health Organization, our professional organizations such as the American Society for Reproductive Medicine and the American College for OBGYN have all said that it is perfectly safe for you to get your COVID vaccine if you're trying to get pregnant, or even if you are pregnant. So I think that is something that you should definitely consider. It's also important, if you've got one scheduled, you need to take it. Now, there is a little bit of a risk. So if you are planning to go through IVF or planning to undergo treatment, you may want to try to have this behind you. If you do IVF, you get your vaccine right around the time that you have your retrieval. You get a temperature. They're probably not going to want to do a transfer if you've got a fever. So it may delay your treatment a little bit. But I tell you, people that get pregnant when they're get COVID when they're pregnant, they can get really, really sick. So we definitely don't want you to put yourself at risk with COVID. It makes the mom sick. It increases the likelihood that the baby would be born preterm. And it increases the likelihood that mom and baby will be separated for a longer interval should you contract COVID during pregnancy. So to make a short story long, I recommend that people get their COVID vaccine, stay on schedule with it, get it at the right time, and just maybe let your provider know that you're doing that so we can keep an extra close eye on you. Great question. Thank you for asking that.
Does look like we're all caught up now, so we are ready to move on to the third and final product of the night.
Excellent. Okay, great. So the last product we're going to talk about tonight is called Menopur. It is a combination of hormones. There are actually two hormones in it. One of them is follicle stimulating hormone, FSH, that we talked about earlier, that's in Gonal-F, as well as it's also in a drug called Follistim. But it has another hormone in it called luteinizing hormone, or LH. Some people really need that LH added to it. And instead of taking a separate shot, which might be a tiny little amount of HCG, the benefit to taking Menopur is it already has the FSH in it too. So it may cut back on taking an extra medicine. Now, who might need this this extra little cocktail with Menopur, the LH and FSH? Some people believe if you're taking an antagonist like Cetratide or Ganirelix, that you should take some LH. Some people don't agree with that. Similarly, some people say if you're taking an agonist like Leuprolide, then you might benefit from taking some having a medication that has LH in it. I happen to believe the latter is important. If you're taking Leuprolide acetate, then I believe that you should take a drug that has some LH in it, because it suppresses your hormones to the point that you may not be making LH at all, FSH or LH at all, depending on the dosage of the medicine. Other people that may need to take it are women that are marathon runners, that are really skinny, ballet dancers, people that have really low BMIs, or people that just have low BMIs because that's their genetics. So those patients may not make enough LH on their own to have a normal ovulation. So Menopur, again, is the combination of FSH and LH. It's given very similarly to the way that we give the drugs that just contain FSH. It's usually a daily or sometimes twice daily injection, and you're going to need the exact same kind of monitoring. Occasionally, patients are prescribed to take a drug that has FSH only and FSH and LH. Usually that's for people that are on higher dosages of medicine and patients that are undergoing IVF. Your provider will tell you exactly what the right medicine and what right cocktail or recipe is for you and your individual health needs and fertility diagnoses and treatments. So Craig, if you'll go ahead and cue up the video, we'll give it a shot to show how to do the, no pun intended, to show how to prepare and administer the Menopur, and then we'll talk about it a little bit more on the other side. I'd like to talk with you about administering Menopur. If your prescriber has recommended that you take Menopur, it's given subcutaneously, which means in the fatty part of your skin. You can either generally give it in your lower abdomen or in your outer thigh. It's quite easy to mix it. It does take a few steps though. You need to start by taking a look at what your dosage is. Each bottle of the powder of Menopur contains 75 international units. So if you have been prescribed 150 units, you will need 2 vials of the powder. No matter how many vials of powder you'll still just use 1 cc of the liquid. So I like to start by opening up the tops from all of the bottles. So we're going to do a demonstration today for 150 units. So you'll need, again, 2 powders, and you just lift the top up of the vial of both powders. It actually just lifts up really easily. And then lift off the top of one of the liquids. The liquids are just a way to dissolve the powder. There's no medication in here. It's important you use this liquid, but don't worry, you'll probably have some liquids left over. The next step is to take a Q cap. You may not have ever seen one of these before, but you just open up the package, and there's a little device that's in here that will just slip right onto the top of the ampule of the vial. So take the vial of liquid and just snap the Q cap right on top, just like that. Next, you'll take a syringe that will be provided with your medications, and it just screws right on top of the Q cap. Then the pretty cool part begins. Just draw back about a cc of liquid. If you get some air in there, that's okay. We'll have plenty of time to get that out. Once you get the liquid into the syringe, take off the syringe and the Q cap as one unit, and that has all of the liquid that you'll need. Next, you'll take the first vial of powder, attach the Q cap, squirt in all of the liquid, swirl it around a little bit, but it dissolves very quickly. Turn it upside down and withdraw that mixture. Now you have 75 units in the liquid in the syringe. Then take the Q cap and the syringe off as a single unit again, and I put it on to the second powder. And it just snaps right on. Squirt in the liquid, swirl it around a little bit to make sure it's all dissolved, and then draw up that mixture. After that's in there, you have both of the ampules of powder, the vials of powder, in the syringe. Just unscrew it, and you're ready to put a needle on the top of it. And you can just take the tiny little needle right out of the package. And similarly, it'll just screw right on the tip of the syringe. And it's ready to give. When you give this injection, you might first want to take an alcohol pad and just swab the area that you want to give the injection. Then take the needle off, take the cup off the needle, bunch up the tissue, insert the needle straight in all the way, and then just push the medicine in. Release the plunger, wait a couple seconds, pull the needle straight out. If you need to, you can wipe the area with the alcohol prep and apply a bandage if you have a little bit of bleeding. But just like that, you've given your injection of Menopur. Easy peasy, huh? So if you've been prescribed to take it subcutaneously, again, remember you can give it just beneath your belly button and out to the side a little bit. Or you can give it in this outside part of your thigh. Or the back of your arm if you prefer. This medication is easy to do. There are a few steps to it, but something that I tell patients to do is to take a look at one of these videos when it's time to do your first injection, and you can kind of do it right along like you're doing a workout video online. You can kind of do your preparation for preparing your medication, for reconstituting the powders with the liquids, so that your medications will be right ready to do and you'll feel very comfortable doing it. I do have patients say that the Menopur may sting a little bit. It may sting a little bit more than what the Gonal-F or the Follistim does. So just be prepared, but it's quick. The medicine's really thin and you can push it in pretty quickly, and then it's done. It may just sting just a tiny bit when you give the injection, but it goes away just as soon as you're done with the injection. So Craig, what questions do we have?
All right, perfect. So this question is by the way it's written, is it clearly asking for a little bit of a recap, but let's see if maybe we can add a little bit of clarity here. So it says, I know you mentioned this before the video, but can you one more time just explain what is the benefit of using Menopur and FSH together as opposed to alone or one versus the other?
Well, that's a very important question. It depends on why you're taking this medication and what specifically is going on with you and what specifically the treatment plan is. So women that benefit from taking this, it's fine for people to get this in lieu of any of the other medications. It's going to work. It's going to work just fine. In fact, the very first drug, the Pergonal that I mentioned in an earlier video, that was the first injectable fertility medication. It had both LH and FSH in it. And then we realized maybe you don't need the LH as often, but it's certainly not going to hurt anything. The advantages to taking this are if you're taking a medication that is going to suppress your hormone production where you're not making FSH or LH. Most commonly, that's going to be something like leuprolide acetate or Lupron. Or if you're taking an antagonist, that's going to suppress your LH and FSH a little bit. Both those hormones are needed for follicle development. If you're taking an antagonist such as ganirelix or cetrotide, then it's important perhaps for you to take a drug that has LH and FSH in it. And finally, if you have a low BMI, or if you're a marathon runner, if you have a condition called hypothalamic hypogonadism, where both the LH and FSH levels are very low all the time, you're going to need some LH for your ovaries to respond. There are some women, we can give them FSH alone all day long, and they're never gonna grow follicles. They just need that little bit of LH. And usually that's for women that are underweight or that are marathon runners or ballet dancers, exercise enthusiasts. Don't see it so much with swimmers or cyclers, but with marathon runners or women that run a lot, we see it fairly commonly. So those are the reasons it's very important for you to take it. But another reason maybe to consider is if insurance covers one better than the other. If I had somebody that had insurance coverage for Menopur but didn't have it for the other medications, I wouldn't hesitate just to give them Menopur. Other questions?
Yes, I just want to throw out there that there is just a shout out for you from Heather on Facebook. Just wanted to say hello, Karen. So just wanted to let you know
Hi.
that we are reading. And yes, Heather Smith, thank you so much for reaching out and supporting the program. All right, let's see. So we have a question. So this one says, how important is it to take my Menopur shot at the same time every day?
So great question there too. And this is something that's much different from taking the HCG. So with the HCG, I tell people to take it exactly at the time it's prescribed. And maybe you can err 15 minutes on either side. But for this medicine, it's much more forgiving. So I tell patients to take the medicines in the morning or the evening. In my case, I tell them to take it in the evening around the same time each day. So if most people want to do it right after dinner and want to do it at 7:30 every night, I say that's fine. And then they call and say, oh, but we've got this dinner party that we're going to. We're going to be at a restaurant with friends. Do I have to go in the bathroom to do this injection? Well, it's fine if you want to do that, but just wait till you get home or do it before you leave. If it varies by a few hours even, that's not going to be an issue. The reason we tell you to take it about the same time each day, we don't want you to take it at 11:30 tonight for one dose and then take the next dose at 1:30 in the morning, where there's just a tiny little bit of time between them. So take them about the same time each day. The half-life is longer than that of some medications. So don't beat yourself up to say, oh my goodness, it's 7:30 on the dot and I'm late. I've got to hurry up and do it. Don't change your plans. Don't miss doing something with friends or family or going to that wedding reception just because that's the time your injection is due. It's important to be that specific with HCG, but not with these other injectable medications. They're much more generous and forgiving. Great question.
Yeah, that's great answer. Thank you so much, Karen, because I know one of the big things that we always try to let people know is the difference between, like you said, the HCG timing and the rest of them. A lot of ways, even for example, on the Menopur, it's a good way to help you remember, right? In the same way that we all take our vitamins like at, the same time whenever you're brushing your teeth or whatever. It's more because of the fact that it's a helpful reminder that you make it part of a process that you follow that will help you kind of jog your memory to remember it's time to take my shot now. If you're taking them at all different times throughout the course of the day, it's hard to remember, did I take it? Did I not? Did I miss a shot or so forth? So great question. Great answer. Thank you so much, Karen. And let's see, we have a question now talking a little bit about side effects with Menopur. And so just asking, what are the biggest side effects that I can anticipate with my Menopur shot? And is there anything that I can do to treat them either proactively or reactively?
Great question. Again, I'm real big into kind of knowing what to anticipate. And one of the things that we want to know about is what side effect you might have. Most people don't have any side effects when they're taking it. Most people feel perfectly normal. Like I said earlier on, you may notice a little local stinging, maybe even a little bit of a redness after you do the injections. I tell people just to go around to different parts around their abdomen when they're doing it. So you can do it like a smiley face underneath your belly button and just do it in a little bit different area every day. That'll keep you from being sore. I tell people to do that with all the injections. Similar to what it is with taking just FSH, such as Gonal-F or Follistim, you're at risk for getting hyperstimulation. So we're going to monitor you closely. when you're taking these medications to try to minimize the likelihood of that happening. But hyperstimulation doesn't generally occur. It doesn't occur until after you ovulate. So it'll be after you take the HCG, probably a few days later, maybe as long as a week later. And if you're pregnant, it's going to last even longer than that. So you're going to want to make sure you stay hydrated. Let us know if you have any symptoms. Right before you ovulate, when it's getting close, as your follicles get bigger and bigger, you may have a heightened awareness of your ovaries. It may feel like when you walk, you feel something kind of jiggling around in there. Like if you've been out working in the yard and you drink way too much water and you almost feel to cool off, you can almost feel the water jiggling around in your belly. Your ovaries may feel like that too, that you're aware something's going on. And when you take a step or when you move, even aggressively, you may feel a little bit more of an awareness of your ovaries. Those things are all completely normal. They're to be expected. But again, always err on the side of caution. If something hurts, if something doesn't feel right, if you don't feel right, you can never make a mistake by calling and asking your healthcare provider.
Sounds good. Thank you very much, Karen. All right, let's see. I'm just checking around. It looks like we are all caught up with our questions right now. So as always, I will give another 30 seconds or so for people if you have any last questions, whether it's specific to Menopur or if you have questions about any of the products we talked about today, or just in general about your fertility treatment cycle the journey that you're currently on or about to go on. This is the time to bring those questions up. And then otherwise, we will get ready to start wrapping up for tonight. So over to you, Karen, and we'll get ready to start closing it down.
All right, thank you. So I really appreciate you all joining us tonight. This is a very valuable program. I feel that Mandel's Clinical Pharmacy has, where you can interact one-on-one with a healthcare provider that is accustomed to taking care of people with fertility issues, that is accustomed to answering these questions and to try to make it as easy as possible for you as you're undergoing your treatment. This program occurs every Monday night, same time, every Monday night. There are different providers from across the country that participate in this, that kind of lead the discussions as I'm doing tonight. If you miss a night, or if I didn't talk about one of the drugs that you're taking, there's probably a video on file with mymandelsPharmacy.com. You can go online to their website. You can look at their Facebook page, and you can find links to all of the PharmAssist, PHARM assist, ASSIST, PharmAssist videos that myself, as well as some of the other healthcare providers, have produced for Mandel's Pharmacy. You can take a look at those. If you want to get a second opinion, you can watch a couple of videos on the same product. That's perfectly fine too. I think we all have something a little bit unique to add that may be of benefit to you. Probably the most important things that I can tell you are, one, you are not alone. Your provider, the practice that you're going to for your care, you should have a good relationship with them, have good one-on-one attention with them as you need it, and feel comfortable giving them a call with any questions you have. You also have the resource of Mandel's Pharmacy, because they want to help you too. They can provide you with information about your injections, kind of guide you along the way, both in terms of the clinical aspects as well as the financial aspects. They want to help you get insurance coverage if that's at all possible. They will walk you through the steps that you need to do, as well as help you with others. They will help you with some of the financial assistance programs, and there are a few of them. They want to make this easy for you without breaking the bank. So don't hesitate to call them. They don't charge you for phone calls. So that should never be a concern, to reach out to Mandel's Clinical Pharmacy or your healthcare provider. We want this to be an easy journey, as easy as it can be. We understand that you're going through so much and you have such high hopes and you want to do everything perfectly. And we want to provide you the support that you need for it. So Craig, I'll turn it back to you one more time to see if there are any other questions, and then we'll close it down.
So we are all good with the questions. And so first off, I just want to say thank you so much, Karen, for your time and your expertise. You are such a calming influence, and you really do help people get through this process. And we love doing this program because really the whole point here is to be able to ask the questions now in a comfortable space so that you don't have to worry about it later. And you did an excellent job tonight with all these questions. So thank you so much, Karen.
My
Uh,
pleasure.
Thank you to everyone who joined us via Zoom and Facebook Live for sharing your excellent questions, or even in some places just saying hello to Karen. There's nothing wrong with that too. Just let us know that you're out there and that we're helping, and that we really, really hope that you were able to learn something tonight. Even if you didn't have any questions, hopefully you learned quite a bit from the questions that were asked. Don't forget, all of these full virtual learning experiences, virtual learning experience videos, or VLEs as we call them, as well as the individual product demonstration videos that Karen just mentioned, are available on demand at our YouTube page, our Facebook page, obviously at our mymandelspharmacy.com/PharmAssist page. We always know that repetition leads to retention, so we say all this stuff multiple times so you'll remember. But there is other stuff there other than just some of these videos. There are some of the different sites where you can get our Leaning on Sunshine page, which is a great way to get support and see what some of your other friends, colleagues, and family members who might also be going through something like this. You can get some support there and know that, again, you are not alone, that, as Karen mentioned. There are videos about behind the shots that tell the stories of why our fertility nurse partners got involved in fertility and why they're there. So you can really get a little bit more of a peek behind the curtain. So it's not just about the medication. There's a lot more there that we highly recommend you go check it out, and you can find out some more information. mymandelspharmacy.com/PharmAssist. So we do look forward to seeing you all here again, hopefully next Monday night at 7 p.m. Eastern for another great program. We're always here, and we're always here for you if you need anything. The most important thing I can say is if you got anything out of this at all tonight, please, please, please share it with anyone that you think can from benefit. So whether it's a family member, a friend, a colleague, somebody that you heard talking about it at the store and you just want to really help them out because you're craving human interaction because of COVID, feel free, let them know about the Facebook or the PharmAssist program via Facebook. We'd love to get new people on that way, and that's really the best way to share the stories from you to other people out there who can use the help just like you did. So thank you again, Karen, for your time tonight. Thank you everyone back home for a great program, and we can't wait to see you all here next Monday on the PharmAssist program. Have a great night.
Thanks
Bye-bye.
so much. Be well.